So first of all, I'll just ask you to introduce yourself and mention a little bit about your career, where you are, your relationship to CAHEC.
Oh, okay. Well, there's a lot of history behind that, Mark. I mean, I've been a nurse for more than 60 years, so it
Wow.
goes back a bit. Um, um, I'm Lola Fehr, and I am a nurse from the old days with a diploma degree. But I left, when I graduated high school, my goal was to get out of Nebraska. I didn't have much else. So I was an undeclared major at the University of Denver. Had no idea what I was going to do. And one of my roommates said, well, I'm going to go into nursing. Why don't you come and check it out? And I did. And I ended up then at St. Luke's Hospital School of Nursing in Denver. The luck I had was that I had a full year of college before I went to my diploma program. So as a result, I only had to do 1/4 of college to get my baccalaureate degree, which back in those days, we didn't realize was as important as it is now. So I never really intended to make nursing a professional career. It was back in the day when, and in fact, I was married to a minister. So my goal was, to be the minister's wife and the mother and all of that. And life circumstances changed. So I did, after being out of nursing totally for 10 years, went back to do clinical nursing in med-surg. They really hadn't invented critical care units when I was at St. Luke's Hospital, so I never had critical care experience. I've never worked in a critical care unit, but I've been med-surg the whole time. That's been my specialty, basically, other than, in fact, nursing administration has really been my specialty after I left clinical care. So that's my background. I worked in Greeley, at the hospital in Greeley, on a night shift so that I could take care of my kids during the day. And then moved from there to staff development in that same institution, doing orientation and for all new employees in the nursing department. And then I've had a lifelong kind of, somebody says an idea and I said, oh, well, okay, let's do that. So a colleague of mine said, well, let's go to grad school. So we did that. And I ended up getting my master's in nursing administration, and then ended up actually as the director of nursing in that same hospital in Greeley. So I was there for 10 years. And then circumstances were such that, I could write a book on when to resign. So I decided it would be best for me to get out of that environment. And I went searching, intending fully to stay in nursing administration in acute care hospitals. But I ended up, my husband at that time was close to retirement, not really crazy to move. And there was nothing in Colorado. So after doing some national interviews, getting a couple of job offers, I decided to stay in Colorado and ended up with the Colorado Nurses Association as executive director. And so that's where I've been since. Nonprofits, Colorado Nurses Association, the Association of Perioperative Registered Nurses. Those were my two actually full-time ones. I went back and did another stint with CNA as an interim for a while. I worked for 1 year for the American Society of Bariatric Physicians. Physicians were not nearly as much fun as nurses. I did an interim as the executive director of the New York State Nurses Association for 3.5 years. I wasn't really interim, but they'd had a long time exec, and I was sort of the bridge to get to a new person. And then, well, since then, I work as a consultant doing leadership development. And I had the opportunity, I really was an interim executive director for the Colorado Center for Nursing Excellence in 2008. For 6 months, I was the interim executive director for the American Academy of Nursing for 3 months in 2010. So I kind of can't hold a job. I just keep moving around, doing different stuff. And I currently work as a consultant with the Colorado Center for Nursing Excellence, which is the Colorado Workforce Center. I work with leadership development and getting nurses on boards for that organization. And I also do their continuing education. I'm their primary nurse planner for continuing education. And I'm a parliamentarian. I started out as a hobby parliamentarian, but I do some parliamentarian work for a various number of organizations
Hmm. In your spare time?
in my spare time. Yeah, actually, and it's very interesting. I've had a lot of reflection. Well, for two reasons actually, because I'm downsizing. We're getting ready to move to a smaller place, so I've run into a lot of my old stuff, that I'm having to cull and
Hmm.
throw away. So I've had some reflection over the years of my career, finding some of those things. But the other reflection I've had these last months, weeks and months, really is feeling, I guess, a sense of guilt almost that I can't get out. I can't volunteer. I have full-time care for my husband, who's 97, so we're not going anywhere much. And he's also disabled, very dependent. And so I'm sitting here without the skills to do acute care anyway. I haven't done that
Hmm.
for years, but still feeling, okay, I'm a nurse, I have an active license, and there's a piece of me that says I ought to be doing more than sitting at home,
Hmm.
but I haven't figured out how to do that yet. So
And sitting on the sidelines, certainly.
yeah, sitting on the
Um,
sidelines. Yeah.
I I explained to Mitzi Moran from Sunrise. She's the executive director there, and she was talking about them all being in battle together. And I'm the same thing. I trained at Cook County Hospital,
Oh gosh.
so and the best thing about that was being there on the front lines with my comrades, fighting the good fight against illness and suffering. And here I am on the sidelines. I mean, that's one reason why I'm really happy that this has come along, these video interviews, because it's a chance I still feel for us to contribute and to contribute to the people. Who knows how many years from now we're going to be looking at this, at these interviews, and gaining something from it and getting some understanding of what's going on. So here we are, two people not currently on the front lines talking about what's going on,
Hmm.
but that's an important perspective too. And my goodness, you've got lots and lots of experience and depth. So hearing how this feels to you and how this feels to you sort of stuck at home, um, we'll explore that. Um, so how are you doing? I mean, aside from this, sense of frustration that you can't be pitching in.
Let me turn the phone on. We're doing well. I'm not as stuck at home as sometimes I wonder if I should be, because I do get out and go get groceries. That's about all I do.
Mm-hmm.
Um, and other than longing for the day I could, go out for breakfast and not cook it, that would be wonderful. And we occasionally, get carry out, but for the most part, we're doing well. I mean, we have family that's close by. Lots
Mm-hmm.
of help we can call in if we need to. So we're doing okay.
Mm-hmm. And I assume you're putting off your move until after this is.
Well, it's in the new construction and it's not finished yet, so it's in the fall anyway.
Yeah.
So what I do have time for is the sorting that I wasn't getting done before I
Mm-hmm.
was staying home this much. I also had a knee replacement surgery in February, about 3 months ago. So I've been rehabbing that as well.
Mm-hmm.
Takes up some of my energy and time is to get that knee going.
And how's that working?
It's doing great. Yeah. I'm impatient, but when the physical therapist says it's doing great, count on a year. I was counting on 3 months and being done. Not realistic expectation at all.
And back doing the jig.
Yeah. Right.
So how does this how does it these are strange times,
Oh,
obviously.
they
We've never
are.
been through anything like this. I actually, my grandfather lost his mother, a sister, and a niece in the flu epidemic of 1918, which put a mark on him for life.
Right.
And he was I think about maybe 20 when that happened. So this is one of those times that everybody will remember very, very well. How, I realize I'm not asking a very specific question, but what's your thought about this? What's your thought about what we're going through?
I think it's very hard to live with the uncertainty, particularly for people like my husband was asking me this morning, how long is this going to go on? He's pretty much kind of a black and white guy.
Mm-hmm.
I'm more comfortable with ambiguity.
Mm-hmm.
A lot of people are not comfortable with that. So a part of it is the anxiety of really how long is it going to go on, because
Mm-hmm.
that is pretty much an open-ended question. But the other thing is I'm just feeling sadness for what people are missing.
Mm-hmm.
The major events, the graduations, I'm talking to my daughter the other day and I said, well, I guess we're not going out for brunch for Mother's Day. I mean, and that's a minor little thing. Canceling the big Nightingale Gala, which would have been this coming Saturday, which is the recognition of all of these outstanding nurses. It's just feeling a sense of loss, I guess. And for me personally, that is not as intense as I suspect it may be for others. So it's ambiguity, sense of loss, and then there are the times when I try to say, okay, we will get through it. We'll come out the other side. It's going to be a different world, but things will begin to move into a positive frame. We're not quite there yet in Colorado, for sure, but
yeah, I don't know that anybody is quite there yet in the world.
And actually, I do have an appointment to get my hair cut on Monday.
Oh,
the
yeah.
salon is open.
Yeah. Well, right now I'm talking to you from Chicago, where it hasn't that hasn't been opened yet.
Yeah, ours just opens this week. So
yeah. Nancy just bought me a beard trimmer. So now I assume you still have friends who are still deeply involved in what's going on. What's your sense of how they're doing?
That's a very interesting question, because the group I work with most closely at the Colorado Center for Nursing Excellence are not any of them involved acutely right now. Now, some of them did at the end of the semester when we were trying to get senior students through their clinicals so that they could graduate. Some of them did volunteer to help accomplish that, and then they closed the facilities down to all students. So they were involved really peripherally, but none of the people I work with, and because I retired so long ago, I know some of the older nurses like me who are retired. I am really not personally acquainted with anybody who's living that frontline story right now. I guess, and I feel that's another sense of loss, actually, because 20 years ago, I might not have been working it, but I would have known people who were. And I just really don't anymore.
One of my sons is a therapist in Seattle, and he switched his practice completely to video, and didn't lose a client. He just took a week of vacation off, which is still a staycation. He's still just staying at home. Yeah. But he said, it's as busy as ever. And with sitting at home all the time, it's more of a strain. It's a different strain. It's a different sort of a strain, and not being with people.
Right. And I talked to a colleague of mine who is also an advanced practice psychiatric nurse yesterday, doing the same thing, of course, with distance counseling, but he's experiencing the increase with the anxiety of people who are really, he said it's just busy. People are anxious and calling in. So he's busier with therapies than he was before. And he's probably, when I said it, I guess I do know him. He's pretty much on the front line in mental health right now.
Yeah. Well, I just got a call this morning from my son, the other son, who's in Phoenix, and he's working from home. He does a business kind of job, and is watching their kid. And now his wife has returned back to work out of the home. So he's trying to juggle all that, and he can't make sense of all the information that's coming in. He doesn't know how to, so I gave him a very good Zen answer, which is, it's just sit with not knowing.
Yeah.
We don't know.
We don't know.
Yeah. Yeah. And as you said, for those of us who are okay with not knowing, which tend to be people who have chosen clinical careers, because you can't know, it's not so hard.
Yeah.
Yeah.
My husband is having he was, because he's been handicapped for a while now, we were really limited in what we did. We were not dancing any jigs, and he can't hear, so we weren't going to the theater and all of that stuff. But his absolutely favorite activity are road trips.
Mm-hmm.
Well, we were supposed to have gone to Florida in April, where I would have worked with the National Student Nurses Association as their parliamentarian. And that meeting, of course, got canceled. And then we were going to come home. And then a month later, we were going to drive to Georgia for our grandson's wedding, which has now been postponed for a year. So his favorite stuff has really been taken away.
Yeah.
You can get in the car and go drive to get gas, and we're getting like 3 weeks to a gallon. So you don't need to buy gas for now.
I know, now that it's finally cheap.
Yes, that's finally cheap. You don't need it.
Yeah. Well, when I drove to Chicago about a month ago, a little over, I literally made 2 stops to pump gas, and I used a paper towel to hold the handle, and had food and drink in my car, and that was it. And I just drove straight through. I didn't touch anything, and there was not much traffic or anything. Few cops. So yeah.
So how are you doing?
I'm doing okay. It's a bit complicated because I've been between Chicago, where my love is, and Greeley, where my home is, and I'm planning to move here and to put my house on the market. This is not an easy time to be predicting the future.
Yeah, we have a house to sell too, so.
Yeah, I know.
I
And I was
that.
patting
The
myself
realtor was pretty positive, so we'll see.
Yeah, I was patting myself on the back for finally selling something, when the market is good.
Yeah.
And who knows? But overall, like you too, I have a partner who I really care about, and we're doing okay. We get a little cranky sometimes, and we've started to, with distancing, see family. I have family here, she has family here, and sitting 6 feet apart and talking and even sharing a meal. But it's okay.
Yeah, we did that last week. Our son and daughter-in-law, 2 other people whose lives have been upended, are full-time RVers. So they spent the winter in Phoenix, and they had planned this trip. I mean, every week planned all the way, traveling through the South, ending up for their son's wedding in Georgia. And of course, that got upended. So they came back here, and will spend, some time here until they figure out their next steps. But we saw them last week for a picnic in the park. They sat at one end of the long picnic table and the other end of the long picnic table. And hey, it worked.
Yeah, well, and that's what I was telling my son in Phoenix, who I talked to today, just before you and I talked. And I said, you can start doing some of those things. Just be careful. Yeah. And needless to say, they're in their they're in their 30s, and so it's a different ballgame for them anyway. Yeah. So just say a little bit, please, about Centennial AHEC and what your relationship to our organization has been, and what ways you can see that we might contribute to the effort of dealing with the pandemic.
Well, I've had my relationship with Centennial AHEC and the board has been really fairly recent, in the last 3 or 4 years. something like that, but have known forever because of Nurse Educator Conference. Centennial, that's what they were really known for when I first really was working with them. I can't remember. We're in 30 years. Let's see, what was I doing 30 years ago? So I was at RN, I guess. But that was how I first came to really know them. But to not know much more than that, except when I was working at the hospital, that's when we began to, the AHECs came into being, and we were working to get continuing education to bring rural healthcare providers into into Greeley from Eastern Colorado. So I worked, had a peripheral knowledge that was going on. But in terms of the AHEC as we now know it in Greeley, which is obviously one of the most successful ones in the country, I was not there during the tough times when Don talks about, being president when they were running out of money and all of that. So my relationship with them has been more recent. And I think what the organization accomplishes in the areas of education, work with the veterans, is pretty darn phenomenal. I mean, the organization looks for ways to figure out how they can be influential in a lot of different ways. I think when we have an executive director that is the leader that Monica is, she goes out and says, okay, here's an opportunity and we can find it. Now, what can CAHEC do in terms of the pandemic? Well, I think this activity is probably one thing, giving an outlet for people to talk about their experiences, for sure. And some other organizations are doing that, so it'll be interesting to see what kinds of things surface. I don't know that we're I was talking to my brother yesterday. He owns a home care agency in Windsor. And he was trying to figure out, because of the JBS factory, the meat plant here in Greeley, and they're open supposedly, but nobody knows. I know they're taking temperatures as employees walk in the door. I have no idea what it's like inside. So he was trying to figure out, okay, what could the home care agencies, if they work together, what could they do to help those employees? I don't know the answer to that question, because it just seems to be out there that we don't know the details of, people who have to go to work and how are they being protected. What do employers need to do that? What do the individuals need to help protect themselves? That's just something I don't know the answers to.
And I'm afraid that that's so mixed up in politics that it would be a very hard ball of twine to unravel. But we do connect people with Centennial AHEC.
Yeah, that's for sure. Well, and of course, you weren't here, so you might know that the Weld County Commissioners ignored the governor's.
I followed that. Yeah. And then, against all prediction, the mayor said, no, Greeley is going to continue with the restrictions, with the seclusion.
Yeah.
Go figure.
Yeah. So, but there was concern about that. And, I will be so happy if we don't see a spike after all of this that's going on. That would just be great. But we've got a couple of weeks now to wait to see what happens out of that. Cases in Colorado are still going up every day.
Yes. So do you know what it's going to be like at your, by the way, I think your hair looks fine, but do you know what what it's going to be like at the beauty shop?
Well, I'm expecting, it's a very small, it's a very small shop. So the chairs are indeed, there are only 3 in the shop, and they are all individually, they're individual contractors. In fact, the owner of the shop is not coming back. She's younger than I am, but not by a whole lot. And her husband died from the virus, and so she has decided to retire. So I think there are only 2 people in the shop. So I'll be seeing something new. We'll all be wearing masks, and I know you're not supposed to go in and sit around. You need to go in at the time of your appointment and have your appointment and then get the heck out of there. And because I don't have to stay around, I mean, I'll get my hair cut and leave. I don't sit under a dryer. I don't, do
Right.
the perm thing. So I will not be there very long, but I'll be interested in seeing. I know that they have to do the, all sanitizing stuff around, stay 6 feet apart and wear masks. That's all I know at this point.
Do you, are there any other things that have opened up that you're going to be now doing that you haven't been?
No, there's not anything that's opened up. They're still doing curbside delivery for like, Best Buy. Although I think that may be able to open this weekend. I'm not sure. But I'm not going to jump in and do all of those things right off the bat.
Mm-hmm.
Anyway, even though I'd like to. I did go to Lowe's last Sunday
Mm-hmm.
morning at 7 o'clock. There was hardly anybody there.
Mm-hmm.
But I wanted these chairs for our patio.
Mm-hmm.
And I tried ordering them online and it would not go through.
Mm-hmm.
And so I'm up at 1:30 in the morning trying again. And I finally did the chat room and the guy said, I can't help you. I don't know, it's a supply problem or what. So I decided to put on my mask and walk in the store because
Mm-hmm.
Lowe's was considered an essential service. So they were open.
Right.
It turned out they were having trouble with their website. So I was there for them to look for it and get it scheduled for home delivery and everything. It took me probably 30 minutes in the store.
Mm-hmm.
But that's really the only place other than the grocery store that I have been in. And I've done pickup, at Red Robin and Olive Garden,
Mm-hmm.
some of those places, but I've not really been in any place but a grocery store.
Yeah. Erica Greenberg, who's on the CAHEC
Mm-hmm.
staff, and really has been doing the administrative coordinating for this and a lot of the interviews too. She was a nursing instructor for years at Ames.
Oh.
And her husband owns the best bike shop in Greeley, and he has been just busier than he's ever been before. That's considered an essential service.
I didn't realize that.
Yeah.
Yep.
That's it's called Bike Peddler.
Oh yeah.
And that's her husband Andy. Yeah, and I understand it as an essential service as a cyclist myself. So
Yeah. So, well, my granddaughter is a registered dietitian working in long-term care. So I think she's been able to do some things distance, but she's got to go into those places.
mm-hmm.
So I texted her last night. They're still doing fine.
Mm-hmm.
So
yeah, and I've talked to some clinicians now too. I've interviewed some, and they're all doing okay too. I think in some ways it's easier than sitting on the sidelines.
I wonder about that. There's this now. I feel for those clinicians that work with those high-risk patients that go home or have to go home or have to isolate themselves from their families. That must be really, really hard.
Yes.
The fear of giving it to a family member, that puts an additional strain on them for sure. But at least they know that they're out there and actively working right there at the front lines, like we've talked about, we kind of both miss.
Yeah. All right. And is there anything else you'd like to contribute?
Well, I think that as long as I've been around nursing for a long time, and back in the day when I was working on my diploma, guys like you, the physicians got to get on the elevator first, get off. We got up, gave them our chairs. I just think it's been interesting to see the nursing profession advance as it has advanced. Nurses being able to practice more independently, and that will be some of the basis. As we are short of physicians, we are going to have to depend on our nurses to become the primary providers or major support for the primary providers, because at the front line of health is going to be a bigger challenge now than it has ever had.
Yeah.
How are we going to pay for healthcare in the future now that we have some awareness of where, we've always known, those of us in healthcare have always known where the gaps are. I'm not sure our policymakers have always known where the gaps are. So I think one of the things that we're all going to be charged with doing as we try to design systems for the future so that we can keep the public healthy is, what do each of us has to contribute, and how do we influence policy so that appropriate decisions can be made for the health of the nation in the future.
I think one of the things we're learning is that in the acute shortage that we've seen with the pandemic, there has been loosening of all sorts of regulations that we all know were too strict, where people had to get a certain amount of experience, because especially nurses and nurse practitioners, and maybe not having enough clinical hours, but still being able to graduate because there was not a way to get them out there,
right,
with probably no detriment to patients at all.
Right.
And I also think that the general model that we've had is that medical care is a doctor and a patient sitting together in a room, as opposed to a team taking care of the person and maybe not in the same room. And that's probably better anyway.
Well, you've certainly done the research and the writing to underscore that part. I think now the scary part that's happening now is the financial hit that hospitals have taken.
Mm-hmm.
ER visits have gone down. I mean, they're laying people off.
Mm-hmm.
And that's just, it just seems the antithesis of what we ought to be doing right now.
Absolutely.
But that financial challenge to keep or make hospitals whole again is going to take us a while. And the paper this morning, the local paper, talks about school districts in Colorado and the hit on the tax revenue, which is going to be a hit to the revenue for school districts, and how are they going to cope. And we've got a tough row ahead for sure.
Well, I think I do believe that hospitals will have to redefine their mission, and their mission will be less to do high margin procedures and more to support general health care.
But we've been saying that for 20 years, Mark.
I know, but I think it's taken a crisis to bring that home. I hope that's realized. Go ahead.
Oh, go ahead. Well, no, the concern I had, or one of the concerns, was ER visits dropping. Now, admittedly, ERs are not primary care providers, but I'm wondering how many people waited too long to get care because they were afraid to go to an ER.
Okay.
That will be something. But yes, the stopping of elective surgery certainly had a major financial impact, for sure. So they're back at it now, but it'll take a while to get that market going again.
Yeah. I wanted to tell you just incidentally, when I was in medical school, we used to do the first 2 years. It used to be traditionally. By the way, I grew up in the traditional where nurses wore caps and all that.
All
stuff.
that, yeah.
And stood up when you walked in the room and stuff. Even when you're a medical student, and they all knew way more than I did from the outset. But when I did, so the first 2 years were basic science, which was lectures and labs. And then you didn't really start doing clinical stuff until your third year. And my first clinical rotation, I decided I liked way better what the nurses did than what the doctors did. And I really thought about changing careers. And then I thought about, how would I do with having to wait for the doctors to get on the elevator first? Or stand up when they came in the room and give them my seat. And I said, I can't do that. And so I stayed with being a physician, but I've been there.
Yeah, well, those days are pretty much gone, I think. But
thank goodness.
At least, yeah.
Well, and thanks to people like you, because you wouldn't put up with it.
Yeah. I certainly did when I was a student, but then I kind of got over it. Yes.
Yes. Yeah. Well, we all got socialized, into our roles, and that's a tough thing to fight. That's a tough thing to get over. Anything else?
I don't think so.
Okay.
I'm going to refuse to retire until some of this resolution comes around, because we are just all so essential. Mm-hmm. And I think we have to get over. I've really appreciated when they've gone, yes, and today's National Nurses Day, But if I sent a Nurses Day card, I would send it to the whole team, because nurses are not successful without the team. I think that's one of the things we've really learned through this. The recognition that the janitors are getting and the transport staff is getting has helped, I think, us to be more aware that none of us do this alone.
That's right.
Healthcare is a team sport.
Yes, it is.
And I think we've really learned some of those lessons during this episode.
I agree. So anything else?
No, don't think so.
Well, I thank you so much.
Well, Mark, it's been fun to talk with you. I'm
yeah.
glad you're doing well.
Yes. Yeah. And you too.